So again, welcome everyone, directly from Portugal and Seattle. You can see that I have my own personal gym here behind me, for another kind of workout. So today we're going to focus on a topic that, like many topics in the little practice that we talk about, I wish I had resources available when I was an undergraduate student. So always remember, all that we're doing is just a sort of a weird revenge over not having had these resources before. So today's focus is on giving a rationale for video recording in psychotherapy. We're going to give you some practical resources. All the slides, I believe you already have the slides that I sent over at the email. The videos that we're going to use will also be uploaded up to our website. That's dpfortherapists.com. So you can use those videos for your own practice or create other, of course, resources for that. And we're going to have time to do a demo ourselves here and some discussion. We won't go into issues of technical and security aspects, legal forms, HIPAA compliance. All those aspects are very important, of course, but to narrow the scope and make this doable and also relevant for everyone, because those issues do vary a lot across countries, we're going to focus explicitly on the actual practice of implementing videotaping in psychotherapy. And just like we said before, this webinar is being recorded and we'll post it on YouTube, so you can use it in whatever way feels good to you in the future. I want to just start off by saying that I come by this honestly, the video recording aspect. So on the left there, you have baby Alex playing piano, and on the right, you have a few years more recently playing saxophone. And I'm showing these pictures just to highlight that in my own conservatory training, it was unheard of someone who had music training that did not record themselves. So listening back to yourself playing and practicing with actually recording yourself was a major component in skill development in music. Now, what we're going to see is that this is actually across many different professional fields, a common practice, a recommended practice actually. And in psychotherapy, this has kind of a bumpy history, but we also do have it. Maybe not as much as would be recommended for the little practice. So that's why we're also doing this webinar today.
Alex, can I just jump in real quickly? If anyone has any questions while Alex is talking at any point, please feel free to type them into the chat window, and I'll be answering questions in the chat while Alex is teaching. Thanks. Thanks, Alex.
Great. Thank you. And please let me know if you want to also make some time for some questions during the
Will do.
So there's this great paper you can see here on the bottom by Haggerty and Hilsenroth. If you Google this, you can find the full manuscript, and it's worthwhile seeing just from a theoretical and research perspective. It's called The Use of Video in Psychotherapy Supervision. And there's this wonderful quote that I have at the beginning, so I'm just going to read this out loud. So, suppose the loved one has to undergo surgery and you need to choose between two surgeons, one of whom has never been directly observed by an experienced surgeon while performing any surgery. He or she would perform the surgery and return to his or her attending physician and try to recall, sometimes incompletely or inaccurately, the intricate steps of the surgery they just performed. It's hard to imagine that anyone, given a choice, would prefer this over a professional who has been routinely observed in their practice of their craft. Now I see a lot of nodding heads, right? So this makes a lot of face value, common sense, right? But it is important to state it because in our own field of psychotherapy, you will find many teachers, supervisors, researchers that either have many valid concerns about videotaping, which there are many valid concerns, or actually really do believe and want to videotape, but have never actually taken the plunge into doing it for many different reasons, right? We're gonna cautiously recommend that at least in some cases, it can be incredibly transformative to videotape our work. And actually, there's some research also by now about the benefits of videotaping ourselves. So I always leave some citations at the end that you can explore with greater depth. But just to kind of give a summary, we do have research that videotaping yourself, your therapy work, or your trainees or supervisees videotaping themselves tends to enhance their self-awareness, So they get to know themselves better in many ways they didn't expect. It counters memory and other biases. There's this beautiful quote by Nietzsche that I love, that between memory and pride, pride always wins. So without the videotape, we become Nietzschean dramatic figures where pride always wins. So videotaping also is a great way to store, study, and disseminate information. Some of my favorite psychotherapy research is based on studying videotapes of psychotherapy. It's a means to re-experience the psychotherapy session. It helps supervisors to accurately appraise their supervisees, right? And of course, that's also one of the reasons we're talking about this, it enhances deliberate practice, sometimes quite dramatically, right? Because there's nothing like actually seeing performance, not reporting on or talking about performance, right? So this is a still picture from one of my sessions. The way I do it, it's very DIY. You can do it rather easily. There's no excuse nowadays, technology-wise, to not do it. I have my little camera pointed at my client, and I have actually a mirror that's pointing at me. Here I have my therapeutic poker face, hoping that it will convince the client that I'm really attuning to them, right? And you can see that nowadays, especially with Zoom, because now we've moved many of us to teletherapy, it's become even easier, right, from a technological standpoint to actually do the work of videotaping our clients. There's then all the other issues about hyper-ethical issues, but also just our own anxieties and concerns over doing this. And that's what we're going to actually focus on today. So one of the main concerns that therapists have and supervisees is, what do the clients think about videotaping? And like always, we have these kind of fantasies that the client will feel outraged or incredibly upset, even about suggesting videotaping. And many of you who have actually experimented with suggesting videotaping probably found that statistically, more than you expected, clients are generally okay with videotaping. As long as, and that's the main thing, they know why you're doing it. So, and you can see also the citations at the end here. You can go, there's some research on this, that when clients know the purpose of recording sessions, and when they know that the purpose is to improve the quality of their therapy, and when they believe it, they generally are happy to consent. Right? And also, fortunately, clients and therapists report that recording devices are soon forgotten. Right? They get immersed in the experiential zone of therapy, and actually the camera kind of goes into the background. Now, it is true that some clients do report not understanding how recordings are used. And that's just a little information from the research that we should take seriously, because it might say that we need to practice giving clearer guidance of why we're videotaping, how those tapes are being stored and used. And all of those rationale givings about why we videotape, how we videotape, all of that can actually be practiced, right? So if your students are really anxious about presenting the idea of videotaping and have a lot of fantasies about clients' reactions, one idea is to actually practice this suggesting of videotaping outside of the consulting room, outside of the therapy room, right? So of course, we're not saying that this applies to everyone and is helpful to everyone. We actually have some counterindications for you to consider when suggesting video recording. So clients who are psychotic, have paranoid traits, or are unable to give consent generally would be best to not suggest video recording. Clients where the power dynamics are very uneven, or the client is very prone to compliance. Clients who have been abused or exploited with cameras and recordings, and clients who are famous or targets of blackmail. So these are just some examples of clients you might want to not suggest video recording. You'll notice that in some cases, you won't know from the get-go some of these variables, for example, compliance of the client, and that's unfortunately just something we have to work with. You can gauge in the beginning, or you might want to wait a while and a few sessions until you actually do present the idea of video recording. Those of you who do assessment work, intake sessions, can do that outside of any kind of suggestion of recording and then later consider recording. Or you might not do recording at all and just after a while see which clients you feel you need most help with and then focus on those for video recording. So many different ways. So just one last slide on this, connecting to deliberate practice. So this is our kind of summary of main principles for deliberate practice. Some of you might have already seen this slide. So these are kind of the 5 core principles we go back to of what effective deliberate practice training would look like. And you'll notice that the first piece is actually observing work. So right from the get-go, the first principle of doing effective practice is observing your performance, right? This is crucial because the expert feedback that we get, the next principle, should be based on that observed performance. In other words, a lot of the expert feedback we might get in supervision, teaching, etc., might not be relevant for our own needs because it's not focused on actually seeing our performance. When we have the possibility to see our performance and show it to our trainers, supervisors, the expert feedback will probably be much more tailored and much more helpful. Just one last note on this. If you do outcome monitoring, which is another practice we would recommend for deliberate practice, then the cycle would start here on assessing performance. So you'd be collecting your outcome, and based on that, you'd see which clients are not being helped or are deteriorating. And those would probably be the clients that you'd want to video record and observe your performance so that you can practice and help them more. I hope that was clear enough. You know, we kind of were able to skim through this because as always, we just want to move to a workout. But maybe we can just take a minute here. Tony, any questions we might want to address before moving? Oh, we can't hear you. Sorry, you're muted.
Thank you. That was great, Alex. So there's been no questions in the chat yet. So I would say just jump into it. And as people have questions, if anyone wants to just type it into the chat and I'll answer there. We could also, you know, take time to answer it verbally later on. So
awesome. Thank you. So as always, we're going to suggest that you actually practice something with us. We're always following those core principles of deliberate practice, meaning we're going to establish a small learning goal, which today will be providing a rationale for videotaping. And then we're going to do behavior rehearsal. Very important to remind us that thinking about your answer or writing down your answer does not count as behavior rehearsal. So to actually practice, you're actually going to talk out loud to the video as if right now you're with the client. Don't worry, no one can hear you, right? So the exercise for today, we're actually going to do 2 exercises. The first one is providing a rationale for videotaping. So the skill description is therapists should be prepared to present a cogent rationale for videotaping therapy without pressuring clients to do so and addressing any concerns they might have. So we have 3 main skill criteria, and depending on how you're feeling, you might want to try to tackle all 3 or focus on one, and then with successive refinement, doing more rounds over time, you can add the other criteria. So what you want to do is to actually, we're going to see a video stimuli of a client. And after this client speaks, you're going to present the idea of videotaping as a way to tailor therapy to the client's needs and goals, to decrease your own blind spots, to maybe get expert feedback if necessary. And you might focus on just one of these if you want, or all 3. You want to emphasize the client's control over any decision to start videotaping and to stop and delete recordings at any time. And by the end, you want to invite clients' questions or concerns over videotaping. So that's presenting a cogent rationale, presenting videotaping as a way to help the client and the therapy, emphasize their control, and invite for questions and concerns at the end. Again, we have a video stimuli here. I'm going to play the video stimuli, and by the end, everyone has I'm going to mute myself as well, and I'm actually going to work out with you. And by the end of the clip, let's talk back to the clip and actually try out based on those skill criteria.
Alex, can I just clarify? This is not a real client. This is one of Alex's colleagues playing a client.
Yes, thank you. That's important.
Yeah.
And these videos, like we mentioned before, are going to be up on our website, and you can use them for your own practice or for your students and supervisees. Okay, so let's put on our empathic faces for our client here. And I'm going to mute myself as well. And by the end of the clip, let's try actually, again, providing a cogent rationale about why we think it would be a good idea to videotape therapy.
You mentioned the possibility of videotaping our sessions. Can you say a bit more?
Okay. I hope I'm not cutting anyone off. So I'm going to invite you now, like always for these exercises, that now we use our deliberate practice reaction form. And if you could please, on the chat window, whoever wants, of course, whoever's comfortable, from 0 to 10, can you say how challenging did it feel to do this exercise? Meaning, how foolish did it feel you trying to meet those criteria we established before? Already getting some responses, great. All right. So I want to thank everyone, not just for responding, but for making me feel less alone, meaning clearly we all want to practice this a bit more, which is wonderful. And probably wish we had had more opportunities to do so in the past. So I'm noticing a trend here, which is now now that we've actually done this reaction form, and you could also, of course, see what bodily reaction you had over time. This would be part of it. But let's just see just what that means in terms of deliberate practice. You'll see that most people actually answered it being in a challenging or even too hard category, right? Oh, sorry, mostly in the challenging. I'm sorry, that's better. So the people who answered around the 4, 5, 6, all of that might be a good indication that you'd actually benefit from trying it again, right? For actually doing exactly the same exercise with the same stimuli, right? If, for example, you found that it was too easy, you'd actually want to amp up the difficulty. For example, you could have a colleague, imagine a colleague doing the same stimuli, but a bit more aggressively, for example, to make it a harder stimuli, or put an added pressure on yourself with an added skill criteria that you might want to be able to mention to your client. Now we're doing this, of course, you're giving an informal kind of feedback to yourself and you're rating yourself. Another way would be to actually do this with peers, and they could also help rate how well you did, how fluent you were, just to get an external sense of how you did and what you could try working out on. If you found that it was too hard to do for some reason, totally fine. You would suggest to do it again, but actually tailor it down in a way that you'd actually find it a bit easier, this exercise. This could mean just focusing on one of the skill criteria. For example, you could just do the first one in presenting videotaping as a way to help therapy, right? And to make therapy more effective, right? Now we found that a lot of these things might make, common sense, the kind of interventions you're doing. The more you actually practice them outside of the therapy session, like any kind of skill, the more probable it is that it will just spontaneously happen more fluidly when you're actually in the session. Okay, so again, thanks everyone for this first round. Let's actually do a same exercise, but let's actually do a different clip. So same client, different clip, and let's see how you do in providing rationale given this clip. So let's try it out.
Is it normal for therapists to videotape their clients?
And again?
Is it normal for therapists to videotape their clients?
All right. So whoever's comfortable, if you can share on the chat how you did in this round. How challenging was that from 0 to 10? So like always, we're seeing a lot of variation in the difficulty, which is actually what we want to get out of a dolor practice exercise, right? Now, just to talk about this important piece, it's really important that all difficulty assessments are welcome, meaning it means absolutely nothing bad or wrong if it feels too hard or too easy, right? It just means that we need to tailor this particular exercise to you. Great. Great. Anna is saying for some reason this was easier than the first. And that's something that's also very interesting, right? Different clips will be different in terms of difficulty across people. Great. Okay. So we've done through that. We had our nice client, curiously asking us about this. And let's just try then a different stimuli. And this is something that yourself, but also your students might be concerned with, which is the awful, horrible event, catastrophic event, if a client doesn't want to be videotaped. I myself have gone through this horrific experience and have lived to tell the story, right? So this is the great thing about the practice. Whatever concerns you might have, fantasies of what the client might say, that's actually a good stimuli for the practice. So when your trainees say, oh, but what if that happens? What you can say is, wonderful, let's practice if that happens, right? You don't have to over talk about it. You can actually make it a stimuli for the practice. So in this particular exercise, let's work on clients who don't want to be videotaped and trying to promote a safe alliance by validating and affirming this preference. So the skill criteria for this would be thanking the client for stating their concern and preference, and then affirming the utmost importance of clients' will, preferences, and safety in therapy, right? So you want to thank them for expressing their concern and preference, and you want to affirm that what's really important is that they feel safe and that their preferences are heard and that their will drives therapy, right? So let's try it. Again, by the end of this clip, please try to talk directly at the screen as if you're right now with this client.
I understand how videotaping can help us, but I'd really rather us not do it.
Okay. So just one last time, I'm going to ask whoever is comfortable to share how that was from 0 to 10 in terms of difficulty. Great. So many people seems to be finding this quite doable. Others a bit more challenging. Again, whatever the difficulty, it's great. So all of you who might already feel that this is quite easy might actually be good candidates to think, who might I want to videotape at this point in my clinical career? Or how might I help my students and supervisees to actually do this in a safe way, right? So besides providing these clips and these slides, we also, if you want, you can of course tailor any of these stimuli or statements for your own purposes. So for example, you can ask a peer, a colleague, to play the client and to do any variation of these client statements. 3 of these are the ones that you saw in those clips. If you find that it's too easy, you might actually want to tailor this in a way that feels harder. So for example, you can ask your colleague to say, what if the client is really ashamed of their body image and they don't want to be videotaped, for example, something very specific. And you can actually play this out in a role play setting. Anything goes. The only thing that we suggest that you do as you're doing the practice is constantly do this assessment and adjustment of difficulty. Because that's one of the things that we're not used to doing in traditional training. Even if we do role plays, we don't usually do difficulty assessment and adjustment. And this is very important so that we keep things challenging but not overwhelming, and so we can learn over time. Another trick that I found with my own supervisees that actually works a lot, and I also use it a lot, is actually recording stimuli on your phone. So I'll actually just do a voice memo of any stimuli that I find difficult. For example, I'm worried that my client might feel a certain way or say something, and I'll say exactly what I'm afraid of to the audio, to the audio memo. I'll record it back, play it back to me, and then I'll use that for a stimuli for practice. So you can be very creative with our recent technology tools, and I urge you to actually experiment because you might find it very helpful. So one idea that, sorry,
Alex,
go ahead.
Can I just jump in for 1 second?
Yeah, of course.
Because I know we have some supervisors and professors here with us. If you wanted to do this with your trainees, you could set them up in dyads where one plays the client, one the therapist, and they go through the scripts that Alex just presented, and they do the difficulty assessments, and then they switch and they go back and forth, and it lets them get a whole bunch of repetitions in. And if you have a classroom of dyads doing that, you can kind of rotate around the room and offer feedback and answer questions and that kind of thing.
Thank you, Tony. Perfect.
Yep.
And you can exactly do all that. And you can ask also the students, what are they afraid of that might happen, right? And you can actually use that to inform the stimuli that they'll do for practice, right? Yeah. Hopefully you'll find it as useful as my students have. They usually say, how come we didn't have this before? So you can let us know. So one last kind of self-reflection, the little practice homework that we want to throw out is actually just asking yourself at this moment, whoever is seeing clients, who are the clients you are most struggling with? And you can actually write this down. Now, there are 2 main ways I think to do this. The one is like objective outcome monitoring. So if you monitor outcomes, you can see who's not benefiting from therapy, who's stalling, or who's actually deteriorating, right? Or from a subjective point of view, who are you most struggling with, even at an emotional level, to actually feel helpful and effective with this client. So after seeing which clients you are most struggling with, ask yourself, would you consider suggesting videotaping with one of these clients? And what concerns might you have in doing this? Next, really ask yourself, and you can also write down, what would be the potential benefits of videotaping this client, right? And we spoke some generic benefits before, and I'm sure there's concerns associated as well, but it's important to also make it more conscious. What would you gain from actually recording these clients? And last, if you feel compelled to do so, you can actually practice before actually going into the room, and you can practice again. You can record, for example, something that would be like this client, or you can practice with a peer, or you can practice good old behavioral style and actually just do it in the room with the client, like a good old exposure exercise. Practice safely, but practice repeatedly. Now, all of what we touched upon today is on the DP for Therapists website. That's the Little Practice Institute. If you go up here, you'll see a videos tab. All of the videos that you saw today, plus many, many more are there that you can use as stimuli for the practice. And you can also find resources on outcome monitoring and videotaping therapy. So book chapters, legal and ethical aspects and concerns. You can find more resources there on the resources tab. Yes, Tony.
Alex, yeah. So, because I know some people emailed some questions regarding like HIPAA laws, regulations, also consent forms. In the United States, at least, it's important to have a consent, like written consent from a client. And we didn't get deep into that because the rules and regulations are different for every country, even state by state, sometimes within the United States. So, but there's links to some great websites that have very, very detailed information about HIPAA, about the laws, the regs. There's a link to a website run by a psychologist who's also a lawyer who has kind of pre-written consent forms that you can purchase for use. And that kind of thing. And please feel free to email us if you have questions about any of those details, and we'll help you as much as we can.
Great. And you also have our email, so feel free to write if you need anything. Thank you, Tony. Yeah. So last thing that we just wanted to mention. So we've been, doing this book series, a lot of research, collaborating with many people around the world. And over the past year or so, we have been developing a certification program for the lawyer practice. So that's for you to be able to actually apply these methods for yourself or to actually be able to coach others in these methods. A lot of people like the idea of the lawyer practice, but it's hard to implement for many reasons, right? Motivational reasons, skill level, etc. So we actually created this certification program that will open on January 1st. If you're interested, you can find more information on the certifications tab on our website, DP for Therapists. We're now coaching a first wave of the lawyer practice coaches that will be able to provide individualized coaching. And yeah, so if you have any questions about that, you can go to the website or ask us about that. And that's actually all that we wanted to share with you for today. I do want to mention just one last thing. I showed you a picture of myself, in the clinical room videotaping a session. I want to say something maybe a little bit controversial, which is I had the pleasure of doing a 5-year psychoanalysis, personal psychoanalysis. And I was shocked by the fact that I learned as much about myself from watching my own videotapes, providing therapy, than actually being in therapy, getting therapy. All the little minutiae of my personal reactions to different stimuli, to different therapy scenarios that I had never realized were part of my character all became excruciatingly conscious as I looked at the tape. And so I actually have a lot of my personal growth actually dependent on videotaping. So I hope that you might find that useful as well. And again, we want to leave open that our emails are open to you if you have any questions or needs related to this in the future. So that's all that I wanted to say. Let's open up for, I know that Tony has been nicely answering a lot of people. Thank you, Tony, for taking that task.
Yeah, sure. I can just answer some of these verbally. Is that okay?
Yes, great. So let's open up for questions.
I was in the middle of typing this answer. So let's see. Denise asked, how's the material stored? And yeah, it's really important that videos are stored in a tightly encrypted method. This is the drive that I use. Here, I'll show the example here. This is called an Apricorn drive. One second. Here, if you can see the logo there, and you can get this on Amazon in the United States for like $180, and this has like, I think 2 terabytes. So this is like a zillion videos or something. And the great thing about this is it's self-encrypting. So every time I plug it in, I have to type in the password. And if it's unplugged, it's encrypted. Which means if it's stolen or if it's lost or anything, it's permanently encrypted. And if I forget the password, it's gone. I can never. There's no backup. I can't call the company to get in. I mean, I guess I'm theoretically like, FBI or the CIA could get in, but like, I'd have to go to them to try to break into my own device. So, so this is like very, very secure, and you can get these. And this is what I recommend, is something that's self-encrypting. So you don't have to remember to encrypt it. And you notice this is not connected to the internet, so that I don't store videos on the internet or transfer them over the internet too. But there are, definitely secure ways to transfer files over the internet. There's HIPAA compliant ways of doing that. So let's see. So that was a great question. Rhonda asked.
Sorry to say that. I just put a link if everyone's interested.
Oh yeah, great.
Reference. Yeah.
Just a second. I was asking because in our country, a psychoanalyst was taken to prison and tortured because he kept the records of his patient, who was a guerrilla man who was also taken to prison and tortured. But I mean, it's a very important issue. And today, where therapists tend to use WhatsApp communication with patients, this is accessible, and therapists don't become aware.
Yeah, this is really important. I typically only store the videos long enough to use them in my own deliberate practice or to get coaching or get supervision, then I delete them. And my consent says that they're not being stored long-term, and I try to go through them and delete them pretty quickly.
Okay.
So I think that's really important. Rhonda asked a similar question about couples. Also, if you have a client that you are concerned about, being like arrested and tortured or blackmailed, or, clients who might sue each other, I just wouldn't tape at all. I just wouldn't do it.
Yes.
Because, you don't need to videotape all your clients. You really only need to videotape like one to be able to get some coaching on.
This was written records, but anyway, it was many years ago, 30 years ago.
Okay. But
it's a matter of registering material, which is very worrisome.
Sure, absolutely.
And furthermore, when you work in a hospital or in a center providing therapy for patients who come back, and so some kind of registration is needed for other professionals to make use of your conclusions. Sure. So it's a great problem because you have to balance quality of care versus patient safety.
Yeah, it's a tricky balance. Absolutely. Let's see. Fabio said software for video recording. If you're doing Zoom sessions, you can record in Zoom. Just make sure that it's recorded directly to a self-encrypting drive. All right. Don't use the cloud recording, but you can set it to record directly to this. And so, Jim asked what software. So Zoom, any software that records, you can tell it where to store the recorded file. And I just have it record directly to these. I recommend against. I do not use my phone for recording. And the reason is many mobile phones are kind of built to automatically be uploading everything they record to like Facebook or Apple Cloud or whatever. They just want to share it as much as possible. And I find laptops or computers are less compulsive about just like sharing everything that's recorded automatically. And let's see. Dan raised an interesting point earlier about the self-awareness, which is, I agree. I keep being surprised as I do deliberate practice when I fill out the difficulty, assessment form. I'm like, wow, I found that easier than expected or harder, or I felt some shame there. Like, where did that shame come from? That's unexpected. But there's layers of self-awareness that can come from this that's really valuable. And it's kind of the secret skill we're kind of sneaking in and teaching the trainees. They think it's all about like practicing these interpersonal skills, but you're also teaching them self-reflective skills. And yeah, Ju said the OBS studio is good. Zoom can be HIPAA compliant if you get the HIPAA compliant, contractor membership. And Dan asked, small discrete camera suggestions. I just have webcams that are like small, and you know, just put them out of the way. And I have an extra long, you can get USB extenders so they connect to the computer or the laptop.
There's also a bunch of action cameras that I think would not be too expensive, and they're very
sure.
small. Yeah.
Sure. And oh yeah, so Fabio asked about other HIPAA recording services. So there's a whole bunch of them and they change every month. So we don't really give recommendations because someone's going to watch a recording of this webinar in 3 months and half of them aren't going to exist anymore. So if you go to the website, personcenteredtech.com, that's linked in the slides, in the first slide. They have an updated current list of HIPAA compliant services. And they also have a great Facebook page. Yeah, I used to try to keep track. It's a part-time job keeping track of that. So great questions. Please feel free to email any other questions you have. Oh, Dan asked about where to place the mirror. Do you want to answer that, Alex?
Yeah, I just put it right next / behind the client. So if the client is sitting, they have the mirror. It has to be one of those long rectangular mirrors, and the camera angle has to be facing it so that the mirror faces myself sitting in the chair. One very small story connected to that. When I bought that mirror for my university clinic that I was also doing sessions in, I would go into that consultation room. I would have the mirror. I would video record. When I would get back to the consultation room, the mirror would be put to the side. And I asked my colleagues what was going on. They said they became so anxious having the mirror there. This is the clinicians, mind you, that they actually had to turn the mirror out. So we had to do a long, exposure kind of thing together so that they would actually feel comfortable with recording. That was way down the line. Join the group. Great. Yeah. I think, video recording has been around for like the 60s and a lot of research in that, but still it's interesting to find, how many concerns, especially in the modern days, this can bring up. So I think for the supervisors out there to start fresh talking about this with your trainees and supervisees can be incredibly productive, because trainees and supervisees just catch the germs that we bring into the consultation. So if we're talking from the get-go about outcome monitoring and videotaping, it just gets ingrained rather easily.
Yeah, it's a cultural shift. I mean, people have been doing it for decades, but it's still a cultural shift. I almost got fired from my first supervision job because I was encouraging my trainees to videotape, and they, it didn't mesh well with the local culture of the clinic.
So then you're asking about any difficulties with clients and the use of a mirror. So they can't actually see the mirror, right? So as far as they are concerned, it really is not a problem for them, fortunately.
I'll jump in here instead of doing the chat.
Then. Great.
Hi. Sorry to bombard you with so many questions.
Oh, great.
Well, they're aware of it in the office environment, and it probably reflects mostly my own misgivings, not of seeing myself, but more of just adds another aspect of we're doing something different than the normal therapy experience.
Yeah.
So do you have any kind of sense of clients and whether they make anything more of having a mirror on the wall next to them?
Can I answer that?
Yeah, go ahead.
Yeah, so it definitely is something different. The videotape is different, the mirror, everything you do that's different counts, and clients notice that, and it's worth acknowledging. I'd say the majority, about 2/3 of my clients consent to videotape, like great. And then, another 10% come around after some time, and maybe 20% say like, no, I'm not comfortable, I don't want it, and that's it. I never try to convince someone or push someone or anything. But we talk about it, and typically what really sells clients on videotape is when they see it improving therapy. So when I am having, challenges with someone, and I bring the video to my supervisor and I get actionable feedback and I bring the feedback back and I'm like, look, I showed the video to my supervisor noticed this thing that I was missing. The supervisor noticed I wasn't hearing you well. The supervisor noticed I wasn't really connecting with you well. So this is what I'm going to try to do to improve. I'm very transparent about all that. And then all of a sudden, most clients are like, this is great. And I actually have had clients who are like, are you remembering to videotape this session? And they'll remind me because like they want to make sure that I'm getting that feedback.
Well, that's helpful to hear in terms of how it becomes a conversation tool.
Yeah.
Part of the therapy versus something you are only doing independent of the patient or client. So
yeah. I try to be very transparent and kind of bring them into the process. Now, some of them don't, they're like, do whatever you have to do to make me better. Like, you don't have to, you don't have to talk about it, whatever will make me better. But, you know, that's generally what people are most motivated by. So
I think then Tony, you just touched on a super important topic, which is all of these are usually conversation starters. So, you know, outcome monitoring, videotaping are actually just a way to kind of bring in even more conversation on these important aspects. So a lot of, speaking to what Tony was saying, I actually had once an alliance rupture over a client who said, where's the camera? You're not recording anymore. And they actually felt that, you know, at a personal level, and we had to actually talk it out, you know, because it could feel like some kind of disinvesting from the relationship. So you'll have a lot of interesting experiences, but fortunately it can all be talked and worked through.
Yeah, Dan, I think you know, what you just described, I think is the most common you know, situation with therapists is they kind of understand the rationale, but there's kind of a bit of an unease because it's introducing something new to the room. And we go through such, you know, effort to create a consistent, safe environment that, you know, the last thing we want to do is mess with that, you know? And so this is a really legitimate concern. It's really good to think through it. And this is part of the reason to rehearse it, is so when you do introduce it, you just feel a little more comfortable, comfortable with it.
Great.
Should we wrap it up?
Yeah. Any last pressing questions? Denise.
Oh, you're on mute, Denise. Let's see. I think I can.
That's strange for a woman, no? To keep mute.
Yeah.
Strange sensation. No, I wanted you to tell us more about this. You said about your own experience in seeing your own videos of the whole psychoanalytic process, because this is not regular practice. So was it regular practice in your place or your own therapist, or did it come specially or whatever?
So maybe just to clarify, I think you're talking about the aspect that I compared my own analysis to videotaping.
It was you. Okay, yes.
Yes. So I was just contrasting that I did my personal analysis, but then when I was actually practicing as a clinician and videotaping myself, I was amazed at how much I learned about myself. And I say tongue-in-cheek, as much as with my own personal analysis.
Oh, okay.
You know, we find these micro markers. I found about myself something, for example, very simple. Every time the client would get angry, I would lose the ability to stay with eye contact with the client. Now, I would never be able to self-report that to my supervisor because it never occurred to me. I never noticed it. But time and time again, I would see my videotapes, anger in the client, my eyes would disappear, right? So I learned a lot, dozens of these small personal aspects that then through practice, I started to actually understand myself a lot better, which is great. It's a nice byproduct.
I asked you because I remembered I had understood a different thing. I remember a colleague who used to draw the session on a panel after each session with her patients and take a photograph and then present it at the end of the therapy, the collection of photographs which showed the evolution of the
That's
process.
Great.
Yeah. So that's a really great, you know, tool for kind of getting a subjective sense and kind of working through the process and the intersubjectivity and the countertransference. But that's not an objective record. And so whatever that therapist's blind spots are just going to, you know, be invisible. And the most valuable thing for videotape for me is seeing my blind spots. So the things I can't remember. And I'll see myself do things on video and I'll be like, oh my gosh, like what is happening? Like, who is that? What, you know, what is he saying to the client? Like, I mean, it's still kind of remarkable sometimes.
We literally have a group supervision, which is an extraordinary experience because, I mean, they share the responsibility. It's 8 brains thinking for one patient. It's wonderful. But we have not yet had the experience of having the group seeing the videotapes. Have you, any of you had this experience?
Yeah, I did years of training with groups watching my videos, and it was very, very valuable.
Just one last idea on this. We will say that, of course, this is anxiety provoking and shame inducing for many of us, or most of us. So that also requires a lot of safety and trust with the group and with the coach, right? So that's one of the major things that we actually strive ourselves to do and to train other coaches, is to really be attentive to self-criticism and shame, because it's inevitable that it'll show up as you're showing tapes.
Yeah, can I know we're wrapping up, but I want to add something about that. One of the unexpected benefits of watching a lot of videos of myself being a therapist is it really helped me address, I had more fear and shame about my work as a therapist than I realized. And as I showed video to people, everyone saw my mistakes and I was like, oh, wow, like this is okay. Like I'm making mistakes, like they make mistakes, like it's okay. That's part of just, you know, being a human being, being a professional. And so I just kind of grew more calm and self-accepting and less anxious about that. The way that like other professionals, like athletes or musicians, like people see their mistakes and it's, you know, the world doesn't end. Okay. So I think that can be very valuable. We should probably wrap up because we're coming up on an hour.
It's a nice note to end. The world doesn't end. I think that's a nice note.
Good, especially these days.
Okay. Thank you so much, everyone, for coming today.
Thank you.
Thanks. Thank you, everyone. Great questions.
Wonderful. Great answers.